Today we are going to the next session, that is viral infection of the skin. Okay, so here the first one we are dealing is Molluscum contagiosum. The disease is Molluscum contagiosum. We can see the eruptions like papules, elevated papules in the skin. Okay, I will see the characteristics. But the spread is small papules. Okay, we can move on to the detail of Molluscum contagiosum. We can see what is the definition of Molluscum contagiosum. A benign skin disease caused by Molluscum contagiosum virus. Okay, and this virus, otherwise known as the standard DNA pox virus. Okay, Molluscum contagiosum is a viral skin disease caused by double stranded DNA pox virus. Molluscum contagiosum virus, otherwise known as the double stranded DNA pox virus. Okay, it is most common among children, characterized by small pearly papules with a central depression. Its core may be expressed out and producing a white cheesy material. Most commonly occurs on face, trunk and extremities. Molluscum contagiosum is highly contagious and spread easily through physical contact. So when you are hearing the word Molluscum contagiosum, the name itself, it shows that it is contagious. Okay, contagious means it spread easily. It spreads through contact. Okay. Next thing, it is caused by a double-stranded pox virus or Molluscum contagiosum virus. Then the appearance of lesions will be small papules with cheese materials inside, and it will be come out. And most common area is face, trunk and extremities, and commonly affected in children. We can see what we can move on to the risk factors of Molluscum contagiosum. People with weak immune system, they are in the risk of any disease. Okay, especially the viral disease. The one of the cause for weaker immune system is steroid drugs. Okay, one of the drug is steroid. The side effect is immunosuppression. Another important factor is viral infections. Those who infected with a viral disease, their immunity will be weak. Then chemotherapy. Chemotherapy is a treatment method for cancer. The side effect of chemotherapy, there will be immunosuppression, myelosuppression. So that's why the patient will have the weaker immune system. They are in the risk of infection. Again, other causes are there. Example, diabetes, kidney disease, cardiovascular disease. All these conditions are immunocompromised state. Okay, so the immune system will be weak and they are in the risk of any infections. Next one, individuals in close contact with the infected persons. That means if the person is infected, it will transfer to other person through contact. In our home, parents may be. Okay, in the school, the teachers or the colleagues or the students. Understand? The same way, if the patient is admitted in the hospital, the healthcare workers, they are in the risk of infection because this virus is contagious. So it will easily transfer from one person to another by contact. Next one, people suffering from atopic dermatitis. So those who are infected with dermatitis. Dermatitis means inflammation of dermis. We will study later about this. I just understand this dermatitis will cause the molluscum contagiosum. Then children between the age of 1 to 10 years, they are in the risk of this viral infection, molluscum contagiosum. It doesn't mean that adult is not infected with the molluscum contagious, but here the adult also will be affected, but the chance is less. And those who are sexually active, that persons will have the molluscum contagiosum in groin area. Okay, so it may spread. Any area it may spread, but the most common area will be face, trunk, etc. Adult may chance for the groins too. Okay. We can move on to the signs and symptoms. The discrete, small, pearly, flesh-colored, firm papules will be present for this molluscum contagiosum. And when we are pressing this lesion or papules, there will be a white cheesy material will be come out. And these lesions usually confined to the face, trunk and extremities in children, and the groins and the genitalia may be affected in case of adult. These are some examples for molluscum contagiosum, and most of them will be in appearance of papules, and sometimes it may lead to the nodule formation. Diagnostic measures, usually there is no need of further diagnostic measures. The clinical features, clinical feature is the best diagnostic measure. Another way is the staining and smear examination. So here what we are doing is we are pressing this papules, and there will be a cheesy material will be come out, right? It will be stained and smeared in a glass light, and we are observed in the microscope. So we can observe the molluscum contagiosum bodies. So that is the accurate test for the molluscum contagiosum infection. Next we can move on to the treatment modalities. In the treatment, the best treatment is prevention. So the patient education is very important. We have to educate the patient regarding the contagious infection, and avoid contact with the another person. Okay. Next one, we can give laser therapy for the patient. That will help to reduce the size of the bumps by exposing them to a low intensity laser beam. So the treatment measures, usually we are doing the laser therapy, then applying ointments containing certain acids to induce the drainage of these blisters. Next treatment modality is curettage. Usually dilatation and curettage will be done together, but here there is no need of dilatation. Okay, the dermatologist may use a small curette that will help to scrap the bumps from the skin. And you can see an instrument, a small instrument used for the scrapping. Okay, that instrument is known as curette. Will helps to curettage. Okay. Next one is cryosurgery. In cryosurgery, we are using liquid nitrogen to freeze the lesions. Okay. So at last the lesions will be went off. So that is the cryosurgery. It is used in molluscum contagiosum. Regarding the drug treatment, we are using Aldara. It's a drug and Tagamet. These all are the two drugs we are used in Molluscum contagiosum. Especially in children, we are used this type of medicine, Aldara and Tagamet. Okay, so we are completing the Molluscum contagiosum.